I was given a PSA test by my family doctor, and it came back high, and then he asked me to go see the surgeon, and I had to get another PSA tablet to qualify that, and they found that it was quite high. So then I had to go, obviously, and meet the surgeon, and he gave me the information basically then. Obviously, I had to go get a biopsy, and then the biopsy confirmed what the doctor already knew. So I had a feeling before the biopsy, actually, but I had no symptoms. I had no symptoms whatsoever. If it wasn't for the PSA test, I wouldn't have known. I had nothing that the regular symptoms that I hear people have. Yeah, I knew a little bit about it because my brother had it about 12 years ago. And when he had it, I looked into it. I read some books and looked in the internet and tried to find as much as I could about it. But it didn't hit home, obviously. It doesn't hit home until you find you have it yourself. My response was actually okay because I was prepared for it. The surgeon at the time told me at the time that bluntly that I had prostate cancer, and I had sort of geared myself to hear that. I wasn't being negative or nothing. I was in a fairly good frame of mind. It was confusing and it was a little frustrating because, again, if it wasn't for the internet, I wouldn't have gotten the information. And then I went to the Prostate Awareness Club, and the members, they gave me further information, and they asked me to go see, basically to get a second opinion from an oncologist at the local hospital, which I did. And I went with a friend, and she gave me a lot of good support because, as we find out later, I think women have a big part to play in this because men, like being men, we're in denial for a lot of things, you know, especially something like this. And I think, personally, I think women have a big part to play in this. So the members with girlfriends and wives and partners, etc., they play a big part, as I say in the...
And how do they play a big part?
Men being men, they're full of testosterone, which ironically drives this whole thing in the first place. And they don't want to come out and say that they have something wrong, because once they find out some of the things that could, not necessarily, but could happen to them, having the surgery or the treatment scares them off. It really does. And as I've talked to other members agree with this, women who years ago who had breast cancer went through all of this, and they've kind of taken it out into the open, and people are very supportive now of breast cancer. And I find that women are more, they talk about it, they bring it out, they're more interested than men. Men kind of hide from it, they do. Men being men, they're not as brave as they think they are. They're, you know, the women are the stronger sex, we all know that. We don't want to admit it, but no, having a good partner will help you with this 100%, no doubt about it. It's like a lot of things though, I don't know if it's shock and denial and it's just lack of experience. It's like a lot of things in life, and it's not until you've experienced it yourself that you realize there's certain things could happen to you that that you weren't aware of. Yeah, I mean, there's no doubt about it. There's all different aspects, and the worst scenario is, I mean, apart from the actual death, I mean, is impotence and all that it goes with it, and that's a big thing for a man. And I honestly think, personally, that's what puts men off a lot of this. They don't want to talk about it, and they don't want to go there with it. It's not until you've been in hospital, until you've exposed yourself to what you go through in a hospital, that you realize there's things I would never have talked about previous to having prostate cancer that I talk about now. Yeah. No doubt about it. No, it's not an old man's disease. It's a man's disease, but not an old man's disease. It's definitely a man's disease. This is why everybody should be aware of this. Everybody's confused about this PSA and what it does. It certainly helped me. If I didn't get a PSA test, I would have died with it within months. I was told that by the surgeon. So, as I tell my friends, if it's $30 for a PSA test, pay it. And if it comes through negative or positive, whatever side, you know, $30, it's not worth, you know. Personally, I'd like the government to okay it for everybody, but that's another issue altogether. First of all, you really need to know if it's in the family. because that plays a big part in prostate cancer. It is a genetic disease. I personally am a vegetarian. I work out at the gym, I do everything that the hospital tells you to do, and here I end up with prostate cancer. So I found out when I was mentioned earlier, my brother was diagnosed 12 years ago, and my mother, who was alive at the time, told me then that my grandfather died of it in the 50s. So that's the first thing people should look at to see if it's in a genetic disposition to get the disease. And there's not I mean, obviously there's other health concerns. I can't speak to this. Being a vegetarian, being a fitness, not a fanatic, but I work out. Yeah, I mean, obviously other things like smoking, overweight, drinking, and all the other things that go, that's bad for any health issue. But I can't preach to people about that. That's their business, what they have to do. But I would look into it. I would tell even young people in their 30s, especially if it's in the family, like I told my son, is to get tested, pay the money. Unfortunately, a lot of doctors won't look at patients till they're in their 40s. And I think that personally is wrong. I mean, I don't want to speak against doctors, but I think it's wrong. I think if someone wants to get tested at a certain age, they should go ahead and do it. I'm not in a position to have kids anymore, but there are younger people who may want to keep having a family until, you know.
Has it affected relationships? I mean, you're a guy.
Yeah. Yes, it has. But it affected my own relation with myself, because being a guy and being active, I'm not in a stage where I mean, men, I may as well say it, men are basically sexually active all their life. And it doesn't go away, and some have got a higher libido, let's say, than others. And yeah, it affected me. Sure, it has. It's hurt my relationships in somewhat, not because of other people, but because of myself being a little bit scared to go enter relationships in case people don't understand. And that's the hard part, you know. The only way out of that, I suppose, and I've been told professionally, is to speak to a professional and go that route, which I haven't taken right now. I'm trying to work my way through it myself, which I prefer to do to begin with. And if I come to a dead end, then I talk to a professional. Yeah, I think if you're single, it's a little bit more difficult, because the men I've talked to, most of them have partners or wives, and they've been very supportive, very supportive. And, I mean, there's other ways of getting around that too, but being a man again, you don't want to be going out there, and let's face it, it's hard for a man to say, I can't get an erection. And then, yeah, there's pills, there's pumps, there's all sorts of aids nowadays, but how many men really want to go out and do that to begin with, you know? A lot of women that I've talked to don't understand why a man has to think like that. And yet there are a few out there who understand that issue. And that is the biggest issue, I think, with having diagnosed with prostate cancer, is anything touching on, let's say, the libido of a man. Yes, it does. And as I say, some men it doesn't matter as much, and some men it matters a lot. And I think that's one of the biggest problems out there. I think it should be spoken about more. And that's what I say about men not wanting to touch this. They don't want to go close to prostate cancer because they know these things can happen. And men being men, they don't want to do it. Women at least have confronted it, breast cancer, and said, yeah, you know, it's a big thing for them. I'm not saying it's worse than breast cancer, but any cancer is bad. Well, this is another reason where women can sometimes step in and give you help with those decisions. I really do like a woman's advice, because they certainly do look at things differently. We're totally different makeups, and I think a woman, that's just what I'm saying, a partner will really help, even giving you some advice and whatever it takes to go look for those avenues. Behind every great man there's a woman, they say. So I mean, it's true in certain cases like this, the women, the right women, I mean, they're not all helpful, but I'm sure there's some people with diagnosed say they never got much help. But no, I think anybody who is a good partner or wife or whatever is very lucky in this regard. They really need that help. They really do. Once you've been diagnosed, is to be realistic and look at the chances of talk to people, like I say, talk to people who have had the illness. They've been a big help to me. The people who have been touched by it, rather than doctors. They talk to the other men who went through this and find out their experiences. And you'll find out that some of them went through a lot worse than you did, and some of them were maybe luckier, if that's the word you want to use. You know, we're all different. We all react to it in different ways. I've certainly never been negative about it. It's never brought me down to the point of I worry about it. I mean, I don't know if it's just the way I am, but it's never bothered me in that regard. You know, it's just, there's nothing better for you is to go up to the cancer clinic and see women and children and the state, unfortunately, they're in. And I'm so lucky. So, no, there's a lot of people worse off. As I said, I think I've learned a lot from other people having more problems than I've had. I have my problems, but they're probably better than some and worse than others. Some people get prostate cancer and a month or two later they're up and walking around and they're fairly good after having such a major surgery, if that's what they have. And some people take a lot longer. Some people are incontinent for years, and some people have no sexual function at all, and some people are very lucky. And I think that's part of the mystique of this, is that a lot of doctors can't say, when you ask them straight out, will I be okay? They can't give you that answer. So I don't know where the answer is coming from there. I don't know if it's a medical community or we all have to look at this in a different way. I really don't know it. That's the hardest part to answer. Being around other guys that have had it helps, because you can talk to people. And then as soon as you say something, they say, I know what you're talking about. It's like going to the moon and saying, I was in the moon. Well, I don't know. I've never been to the moon before, but I can imagine. But until you've been there, you can't, you know what I mean? It's like anything in life until you've experienced it. I really don't worry about the little things anymore. There's very few things that actually bother me as much as they used to do. And which is great, because I've let go of a lot of things that used to, like relationships that used to live with me for a long time. It doesn't bother me anymore. And I take life more as it comes. Like, you know, I hate using cliches, but the day-to-day thing really hits home when you've been diagnosed with cancer and you actually do live from day to day. I never make long-term plans. I go visit I have to go see my doctor every 3 months for tests, and so I live in a 3-month cycle. And that's how I live my life. And it's not being negative. I can't honestly say I go out and live every day to its fullest. That would be stupid. I don't. I have bad days and good days like everybody else, which means I'm normal, you know? Like, that's all I want to be, is normal.